Hello again, many thanks for choosing us. Now, tonight, Ghanaian health officials are racing against time to prevent the spread of monkeypox disease after 5 cases of the rare infection has been confirmed in the country. Now, these were from 12 samples collected across the country. Though the first cluster of the latest cases of monkeypox were detected in the United Kingdom, the disease is fast spreading in Nigeria, Cameroon, and other West African countries. Tonight, the disease has arrived in Ghana, with cases recorded in the Western, Eastern, and Greater Accra regions. Manuel Cranton of our health desk was at the news conference where this was announced, and now reports.
5 cases, they are all well, nobody is critically ill, and that we continue our surveillance to ensure that all cases that are identified and isolated.
That is the Director General of the Ghana Health Service, Dr. Patrick Kuma-Abuaje, announcing Ghana's monkeypox cases recorded in the latest wave of the disease. West African neighbors like Nigeria and Cameroon are already recording large numbers.
In 3 regions, Eastern, Western, and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded by a Ghanaian who traveled to the United States from Ghana.
Monkeypox is a zoonotic disease caused by the monkeypox virus, transmitted from infected animals like rodents, monkeys, amongst others, or from infected humans. There are currently over 1,000 confirmed monkeypox cases in 29 countries. But how does it manifest?
It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how we went. And then, of course, then the rash and the blisters will appear.
There is no known cure for monkeypox. Even though there is a vaccine for monkeypox currently in limited supply, it is not yet available here in Ghana.
There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so especially the West African one is mild to moderate. So we only treat at the symptoms. If you have fever, we give you something to bring your temperature down. Body aches, we give you some painkillers to bring it down.
Dr. Patrick Kuma-Abuaje says the Ghana Health Service has stepped up surveillance to help keep a leash on the spread.
And then we have also sent sensitizations of clinicians, and then we've currently started contact tracing. So any case we have, any contact we have, any positive case, we do all their contacts to make sure that.
My colleague Manuel Cranton filed that report. Now, bushmeat sellers in Kumasi have rejected the suggestion that the consumption of bushmeat can spread the disease. This comes on the back of a warning by the Ghana Health Service cautioning against the consumption of bushmeat. My colleague Nanel Jima has been interacting with them, and he joins us via Zoom. And Nanel, you've been out there today interacting with these sellers of bushmeat. What is their basis for their rejection?
According to the sellers I spoke to today, they believe that due to the works that the veterinary service have been doing on their products that they sell, these products are spread by the Ghana Health Service. They believe that their products are wholesome. And according to them, over the years, whenever there's a new disease, their products are targeted to the Ghana Health Service and other agencies. So they are saying that it is one of the deliberate attempts to deliberately affect their business negatively. That is, it's one of their attempts to kill their businesses. That's what some of them are telling us.
Okay, and they cite the situation with COVID, for instance. But how are consumers also reacting to this, the people who purchase from them?
So some of the people that I've been speaking to are not aware of the monkeypox in the country. According to them, they are yet to hear anything officially from the Ghana Health Service. So they wouldn't halt the eating of the meat. So at the time I went there, I saw some people in queue purchasing the meat. So it looks like the Ghana Health Service have some work to do in regards to this area.
But in Kumasi generally, what's been the reaction to the announcement today that was made by the Director General of the Ghana Health Service that we've recorded 5 cases already?
So from the conversations that I've been having with people, it looks like it's yet to catch up. A lot of people are not aware of the breaking news that some cases have been recorded in the country, probably due to the sensitization from the media. Lots of people in the city will get to know about the outbreak of this disease and take precautions to ensure that the spread of such a disease is checked.
Nana Ojima, thank you very much for bringing us those details from Kumasi on how bushmeat sellers are rejecting the suggestion that consumption of bushmeat could actually aid in the spread of the virus. But while health officials attempt to get a grip on the monkeypox disease, COVID-19 infections are also on the rise, with more cases of influenza virus also being reported at some hospitals. Dr. Patrick Kumar-Boaje wants people to go back to wearing face masks in enclosed areas.
Vaccine wearing is not compulsory, but that has been our normal message. There are high-risk areas where if there's a patient who has it there, transmission is high. And these are enclosed spaces. These are places where there's very close contact, mass gathering, where people are then. So these are areas we continue to encourage that.
Schools, churches.
Schools, churches, inside an airplane. We encourage that people should wear their masks for that period that they are there, especially to help us assuage any further spikes. Workplaces where there's a gathering, people must wear their mask. In my office, if I'm there alone, I may not wear it, but as soon as I have visitors, I wear. And so you need to put in a system that creates some social distancing and also wearing a mask where you need to.
Prime with me and Asminu. Let's return to our earlier story on the cases of monkeypox that has been detected in Ghana. 5 of them so far. Let's go on to the phone lines now and speak to Professor William Ampofo, who is head of virology at the Noguchi Memorial Institute. I'm grateful, sir, for your time here on the bulletin. So let's first start with some education. In terms of how this disease spreads, I am under the impression it works as Ebola spreads. Is that right? Is that a right assertion to make?
I'm sorry, let's have a correction. I am retired and I'm working in the University of Ghana on post-retirement contract. So the current head of virology is Dr. Kofi Odum.
Very well.
So let's have the affiliation correct, please.
Very well. Thank you so much for that correction.
Yes, so what was the question again?
So the question in terms of how this spreads, does it work like Ebola, like we've seen in the past?
Well, it's spread by coming into contact with the fluid from, it's a rash that is a sign of infection. So when you come into contact with fluid from the rash of a person, you probably have also broken skin. Your skin is not intact, then you could get infected. There has been infection of healthcare workers from contaminated bedding of patients in health facilities. So that's the mode of spread through contact with contaminated fluid from an infected person.
How vicious is this as compared to COVID or even Ebola, the death rate, for instance?
Totally different from COVID. COVID is a respiratory infection, so it's airborne transmission, through droplets in air on surfaces. But monkeypox is transmitted by contact with infected material, so on surfaces, and not airborne transmission. So completely different, please.
How fatal can it be?
The actual cases have been mild, So monkeypox is associated with mild illness, and then the case fatality rate is actually very, very low. These rashes, like pustules that appear on the skin, that makes it a very, the symptoms are quite graphic, but mortality rate has actually been very low. I think it's recently in Nigeria. There was an ongoing in Nigeria for the past 2 years, and it's I think recently that there's been description of a couple of people who have died from this infection. Usually it's mild infection.
What should we look out for in terms of the symptoms and how to detect this?
The Ghana Health Service has published a correct set of case definition for clinicians, and this rash that usually appears, and it's distinguishable from chickenpox. We know that smallpox has been eradicated, so having a rash that doesn't go away, spreads from the face and then towards the extremities. So the clinicians have a good idea of what to look out for monkeypox.
What can we do to contain the spread of this disease? Already we know that one of the one of the 5 was actually imported, one of them from the US. And so how do we contain this?
So actually, monkeypox is endemic in West Africa. Okay, so that's why I referred you to the ongoing outbreak in Nigeria, which the Nigeria Centers for Disease Control described last year. And we know that monkeypox is endemic in Africa. So we actually have records of the first cases being exported to the other parts of the world. So containment and prevention of spread is actually setting up the diagnostic system, and we do have that at Noguchi, and some of the other centers are also setting up is molecular diagnosis, looking for the presence of the virus in materials, and being able to pick it up with the molecular method is the standard approach for emerging, re-emerging viruses.
Like COVID, we saw asymptomatic cases. Can we have similar situations with monkeypox?
Yeah, with any viral infection, or with any, where the person is infected before the rash appears, there could be asymptomatic cases. But I think so far the data that we are getting from the Western countries, where there have been the spread of rash of cases spread in the past a few months, is being associated with homosexual activity. So as I said, if there's a break in the skin, then this could lead to transmission of fluids from an infected person to another person. So safe sex would limit transmission from what we know so far of the recent cases. And then, of course, infection prevention, the standard thing, but not like COVID, which is a respiratory pathogen airborne. It's a standard thing, hand washing and good personal hygiene.
The Director General of the Ghana Health Service indicated that there's vaccine for this, but he doesn't think that it is time or the situation warrants, procurement of the vaccines. What do you think? What is your position on this?
Yes, there has been the discussion that there's been modeling that showed that with the eradication of smallpox and therefore the discontinuation of the smallpox vaccine, the world could see another pox virus emerge, and some are thinking that it is associated with, in some cases where smallpox vaccine could be used to have some significant immunity. But as the DG rightly said, smallpox has been eradicated, and it's not time to start thinking that the smallpox vaccine should be activated and deployed. Let's wait and see. I mean, as I said, the cases are endemic in West Africa. Our neighbor Nigeria has had some significant cases and is monitoring the situation. Knowing that a vaccine is an effective tool, like we're using for COVID and for Ebola, we could set up some, look at where, the epidemiology of the virus, look at where people are susceptible, and then set up some kind of program where we could offer protection to those people who are most at risk.
Very well. Professor William Ampof, I'm grateful for your time. That's a virologist at the University of Ghana. He was formerly the head of virology for the Noguchi Memorial Institute for Medical Research. The Director General, the Director of Public Health at the Ghana Health Service, Dr. Franklin Nesidi-Bequin, has been given more detail on the new cases. He spoke on Joy FM on Newsnight.
It's actually endemic in Nigeria and part of Central Africa, including like Cameroon. So if you pick up Cameroon, or Nigeria, they've been having cases over the past five years. The issue was the occurrence of monkeypox in non-endemic countries, particularly in Europe and the US. So that brought about the scare. So for Ghana, what we did was that we immediately sent an alert to all our health facilities, and then we also sent common messages to the general population to sensitize them about how you can report a case if you think you have one. But the first case that we had was actually a case that was confirmed in the US. So it's a lady who came for holidays and went back to the US and then got a rash and then was confirmed as monkeypox. So we were informed and then we went to the husband and then we took the sample. So that one came as a positive case.
Was she in Accra? Just to clarify, did she live in the Greater Accra region? Where exactly was she residing?
Oh, I don't think we want to communicate that kind of information. But the issue is that the person is in Accra, so our team went to him. Apparently, he had gotten some rashes, but was not sure what it was. But when the wife was confirmed, I mean, that was the time that we had gone to him. So we took a sample, it came as positive. The other ones were not sure what was. Like was a baby of 2 years, had some rash, the mother sent to the hospital, and they took their sample, it came as positive. But I think what is good is, one, is your system able to suspect? So do you have clinicians who can suspect? Basically, you do that when you use the case definition.
Well, before you get into that, Dr. Asiedubekwe, I would want to find out, at least you've talked about this woman and the husband, these cases were recorded in them. Other 3 cases that were recorded, did they have any relationship whatsoever with these 2 persons?
No.
Okay.
No, there's no linkage between these cases. Apparently, so far, we are struggling to establish the source of the infection. It's zoonotic. So it's like it can start from an animal to man. But so far, we are struggling to see how the cases got infected. I mean, sometimes it's faster to get it. So as I said, the other cases, they are also children who go to school, get on rash. And then because the clinicians have high levels of suspicion, they put a sample and then the lab confirms them.